Hello, my name is Christina Bolden. I am the visionary and the founder of Exposure Incorporated, which is a provider of sexuality education, training, and consulting services. My sorors of Delta Sigma Theta Sorority Incorporated, Southfield Alumni Chapter, has invited me to come before you today to talk about a very important topic, HIV and AIDS, in honor of World AIDS Day. So I thank you, sorors, for inviting me, and guests, be open as we go down this path and talk about HIV and AIDS. So what does HIV stand for? It stands for Human Immunodeficiency Virus. What does AIDS stand for? Acquired Immunodeficiency Syndrome. What's the difference between HIV and AIDS? Well, HIV causes AIDS. Well, how does it cause it? It's because it's a life cycle. HIV has 4 different stages. 1, it is the acute, when somebody is newly infected. 2, asymptomatic, the longest uncertain period where a person doesn't show any symptoms. 3, the symptomatic stage. 4, HIV advanced disease, which means AIDS. So AIDS is the 4th stage of the life cycle of HIV. So, with that stated, there is a difference. Is there a such thing as a full-blown AIDS? No, it's not. AIDS is just a diagnosis of an individual who is looking at the progression of a disease. The goal of the medication, once someone knows that they are infected with HIV, their immune function is looked at, their viral load is looked at to determine what is the best medical intervention. The goal is to get an undetectable viral load. Why? Because it causes a person to be in a healthier state, where they're less likely to get sicker quicker, or to transmit the virus to other individuals. How does one become infected with HIV? Well, there are some things that people may do to increase their susceptibility. 1, having unprotected anal, vaginal, or oral sex. 2, sharing needles with individuals or their works, meaning the drug equipment, with people who are infected with HIV. 3, it can happen from mother to baby during birth or through breast milk by doing breastfeeding. Or if you are a first responder or a healthcare worker accidentally being poked by a needle. So those are the ways that people can actually contract HIV. The key thing is someone has to be infected with HIV to then transmit it to other individuals. Those behaviors are linked to fluids that can contain HIV, which is blood, semen, vaginal fluid, breast milk, cerebrospinal fluid. Those are the fluids that HIV can be found in if someone is infected. And that's how transmission occurs. PrEP stands for Preexposure prophylaxis, which is something that can be taken specifically for individuals who are engaging in high-risk behaviors with partners that they know are infected with HIV, or they engage in behaviors that can put them at a greater risk of contracting HIV. This medication is offered at local health departments or providers, and it is oftentimes covered by insurance. However, if not, there are programs that will help individuals to be able to afford the medication. So this medication would need to be taken at a regular time on a daily basis to avoid becoming infected with HIV. Let's talk numbers. Globally, it's about 38 million individuals living with HIV and AIDS. Here in the United States, it's about 1.2 million individuals living with HIV and AIDS. Specifically in Michigan, it's 16,306 individuals that are living with HIV and AIDS. When you look at race, when you look at people of color, brown people, one of the biggest global hotspots is sub-Saharan Africa. They carry about 30% of all of the HIV/AIDS cases worldwide. Here in the United States, I stated that it's about 1.2 million individuals living with HIV. However, African Americans represent 14% of the population, but carry over 42% of all of HIV/AIDS cases nationwide. Here in Michigan, it's 16,306 individuals living with HIV. African Americans represent about 14%, but carry over 56% of all of the HIV/AIDS cases. I'm saying that to say there's a problem here. There's an issue here, and it's been here for quite some time. We're dealing with what you call health disparities. We're dealing with the root cause being linked to oppression and racism, lack of education, lack of access of health care, lack. I can go on and on. However, it is within our power to educate ourselves, to get tested, to be mindful of who we share our bodies with. If we are an injecting drug user, not to share needles or use clean needles. Go to a syringe clinic. Use PrEP if you're going to continue to engage in risky behaviors linked to sex and sharing of needles. At the end of the day, it is up to us to take responsibility. Knowing our status, getting tested, taking PrEP, using condoms, it is within our power. So today, I hope you have learned something, refreshed some of your memories, and know that HIV and AIDS is still here, and you need to be protected. So take care, and thanks for having me.